Good day, everyone. I am honored to join you as part of the annual 30-day Career Boost Initiative for African Youth, organized by Street Pathways Youth Foundation. Today, we will be exploring a critical aspect of our Global Development Goals, Sustainable Development Goal 3, Good Health and Well-being. This presentation will cover the importance of ensuring healthy lives and promoting well-being for all, as well as the challenges and opportunities related to health on both a global and local scale. Whether you are a secondary school student just beginning to think about your future or a tertiary institution student deep into your studies, understanding these issues is vital. Together, we will look at how we can contribute to this goal and make a meaningful impact in our communities and beyond. So thank you for being here, and let's dive into the world of SDG 3. If you have questions or comments, please direct them via email. And don't forget to specify your name, your position, and your country. Thank you for your understanding. Pour ceux qui parlent français, merci de communiquer toutes questions ou commentaires par email. Et n'oubliez pas de spécifier votre nom, votre rôle et votre pays. Merci pour votre compréhension. Our objectives for today are the following. Understand SDG 3 and explore its specific targets. We will identify key health issues, review some progress, and finally, we will promote personal and community actions. In the coming minutes, I want to convey that everyone can play an active role in improving global health and reducing inequalities in healthcare. So now, let's see what is SDG 3. The Sustainable Development Goal 3 is centered on ensuring healthy lives and promoting well-being for all individuals regardless of age. It highlights the importance of accessible healthcare, focusing on reducing maternal and child mortality rates, fighting epidemics, and addressing mental health challenges. SDG 3 advocates for universal health coverage, emphasizing the need for quality healthcare services that are available to everyone. As you know, health is not only a personal concern, but a global priority influencing economic stability and social development. So by striving for SDG 3, we aim to create healthier communities and empower individuals to lead fulfilling lives. Ultimately, this goal encourages collaboration and innovation, reminding us that a healthier world is within our reach if we work together. So now, why good health and well-being are fundamental to sustainable development? Good health and well-being are central to sustainable development for several reasons. At its core, health is a cornerstone that supports the functioning and progress of individuals and communities alike. Health for individuals is crucial for personal development and productivity. When individuals are healthy, they can fully engage in education and work, thereby improving their personal potential and contributing to the economy. For instance, as you can see here, a healthy student is more likely to attend school regularly and perform better academically, which translates to better job prospects and higher income potential in the future. I remember that during my medical studies, I knew someone very diligent who was always at the top of his class. You know, in school, we spent many sleepless nights, but he took it to an extreme. During exams, fatigue took over and he experienced burnout. He struggled mentally and couldn't recover in time, costing him a semester. This illustrates that a highly motivated and hardworking person with great productivity can become entirely incapacitated when they fall ill. This highlights how crucial physical and mental health are for our productivity. I share this anecdote to you to take care of yourselves and your colleagues, especially during intense study periods. That's very, very important. But good health and well-being are not only essential for individual success, but also for the overall progress and stability of communities. Health impacts the broader social and economic fabric of communities. Communities with high health standards enjoy greater economic stability and resilience. Good health reduces the burden on healthcare systems and lowers the economic costs associated with illness, such as lost productivity and medical expenses. For example, in many regions, combating diseases like malaria or improving maternal health can significantly boost economic output and reducing poverty levels. Furthermore, health is interconnected with social well-being. As you can see here, healthy individuals are better equipped to participate in community activities, support family dynamics, and engage in civic responsibilities. Unfortunately, in many places around the world, populations don't even have access to the basic health care. Now, let's take a look at some global health issues. The list of global health issues is quite long. I have shared with you here some of the most popular. We have the healthcare access, maternal and child health, infectious diseases, substance abuse, health equity, migration and displacement, non-communicable diseases, environmental health, and nutrition and food security. Now let's talk a bit about healthcare access. As I said, it's very sad to admit that healthcare access still represents an issue in many places of the world in 2024. Considering the importance of health in someone's existence, we can say that the lack of healthcare access is a violation of the right to live. So many precious lives have been lost because of the absence of healthcare. According to the World Health Organization, half of the world's population lacks access to essential health services. In addition to the fact that healthcare access is a big challenge for many, when they do find the services, the high cost represents another problem. The World Health Organization has reported that 400 million people are in extreme poverty due to money spent on healthcare services. In other words, globally, 400 million people are now living with less than $1 a day because their financial resources have been spent to recover their health. That is very sad. Now, what about maternal and child health? We all love our mothers and their little babies for good reason. They are one of the most vulnerable groups in society. They need love, they need support, they need understanding, and surely they need good health care. As you will see here, this category faces many challenges when it comes to SDG 3, and a lot needs to be done in order to improve their well-being and health. Here are some data from the World Health Organization. Every day in 2020, almost 800 women died from preventable causes related to pregnancy and childbirth. In the same year, a maternal death occurred almost every 2 minutes. UNICEF reported that in 2022, almost 5 million children under the age of 5 died from preventable or treatable diseases such as diarrhea, pneumonia, and malaria. That's also very sad. But despite the fact that many global issues are trending, we must commend the effort of some successful strategies that the World Health Organization has initiated in tackling the burden of global health issues. Here are some of the most impactful ones. We have firstly the expanded program on immunization. It was launched in 1974. This program aimed to make a vaccine accessible to children globally, especially in low and middle income countries. One of the great successes of this program is the implementation of the World Health Organization's Global Polio Eradication Initiative, which has reduced polio cases by over 99% since 1988. We have secondly the HIV/AIDS program. Thanks to the introduction of antiretroviral therapy, the number of HIV infections has dropped to 52% since its peak in 1997. As of 2024, almost 30 million people are receiving antiretroviral globally. We also have the WASH program. The WASH is about water, sanitation, and hygiene. The World Health Organization, in partnership with UNICEF, has been working through the joint monitoring programs, which tracks progress toward universal access to water and sanitation. Improved WASH conditions have significantly reduced the incidence of diarrheal diseases and waterborne infections, especially in low-income countries. Finally, we have the Mental Health Action Plan. Many countries have adopted national mental health policies and programs, and mental health awareness has gained significant global attention. Increased focus on mental health, including the establishment of services in low-resource settings, has improved access to mental health care for millions of people. Those are very interesting programs. Despite these programs, the global burden of disease is still very heavy due to our weak healthcare systems, particularly in the low-income countries. So now, we will explore how the youth, can play a significant role in advancing SDG 3. I learned that Nigeria is one of the most populous countries in the world, and it is the most populous country in Africa. Nigeria has one of the largest youth populations in the world. Do you know what that means? You are the strength of the community, of your country, and you can play a very important role in advancing SDG 3. Today, I want to make a call to action to tell you that you can achieve great things. You just need to have the will and collaborate. One of the tools you can use is awareness raising. You can also use volunteerism, networking and collaboration, and sustainable practices for sure. But before talking about these tools, I want to advise you to learn about the topics that interest you, because before raising awareness, you need to educate yourself on the topic to avoid spreading false informations. Awareness raising is an essential way for you to contribute to SDG 3. You can organize awareness campaigns to educate your community on specific health issues like mental health. As you know, someone may appear physically healthy, but their mental health may not be well at all. You can create workshops or discussion forums, organize awareness sessions on depression and anxiety, inviting experts to speak about the importance of mental health and the resources available. It's also very important to pay attention to the people around you. I can assure you that can make a very, very significant difference. You can also promote awareness about infectious diseases and how they are transmitted. By educating people on these subjects, you enable them to prevent certain illnesses. This will help reduce the burden of infectious diseases in your country and in the entire world. You can engage, by example, in awareness campaigns on diseases like HIV, AIDS, or tuberculosis. For example, a campaign distributing condoms and information about HIV in schools can reduce stigma and encourage safer sexual practices. You can also leverage social media to raise awareness among a broader audience. That's very important. You can also participate in or organize healthy-related volunteer programs, and this will help improve community health. Finally, I want to encourage you to join youth-led organizations to amplify efforts in addressing health issues and foster collaboration with other stakeholders. By example, there is this organization called United People Global, or UPG, which empowers youth to, they give a free annual training on sustainability leadership, and their mission is to make the world better and sustainable. In this regard, I would like to commend the N Street Pathways Youth Foundation for their truly commendable initiative. Education is really, really the foundation of any prosperous society. So to conclude, I want to remind you that healthcare is a human right. Both physical and mental health are essential for our well-being. Don't forget that SDG 3 related challenges in the world are multiple. And your role in the achievement of SDG 3 is just crucial. So I hope that you will get involved as soon as possible to contribute significantly to achieving SDG 3 for a healthier future for Nigeria and the entire world. Thank you so much for your attention.